Hi, I'm Chris Crimmins,
I'm Rebecca Fishman.
and we're going to present a PowerPoint on ACT therapy, acceptance and commitment therapy. Now, this is the original wave, the original member of the third wave of behavioral therapies, and it follows on the footsteps of traditional behaviorism, which came about in the mid-1950s, followed by cognitive behavioralism, which was in the 1970s, and then this third wave came around in the mid-1980s. It's referred to as ACT, not by the letters ACT. Russell Harris, who we read an article of his in our course, he's probably one of the best published and most noted proponent of ACT therapy. You may have read The Happiness Trap. He's published several books that are very, very good on developing ideas around relational frame theory and ACT therapy in particular. There are two other therapies that have been included in the third wave of therapies. They are dialectical behavior therapy, DBT, and mindful-based cognitive therapy, MBCT. The core message of ACT is that you need to accept what is out of your personal control. And you have to understand that most things are just a product of language, of communication. We have to accept that there will be discomfort. And in the video, you will hear that we talk about clean discomfort and dirty discomfort. And by accepting that dirty discomfort does exist, those discomforts don't have an impact or influence over you. Accepting that dirty does exist, you can use the core process to minimize the effects by committing, examining the values, and deciding what important events and activities you want remaining in your life. ACT breaks mindfulness down into three different categories. Here we have diffusion, which is it's realizing that the thoughts, beliefs, memories are just communication, just language in our mind. We separate ourselves from the thoughts in our head and what is present here and now. Diffusion is realizing that thoughts, beliefs, and memories are just communication, and that it's the language in our mind, so that by addressing dirty discomfort in addressing mental health issues, we're avoiding having to try developing avoidance skills or rationalization or disputing those levels of discomfort. ACT allows you to experience discomfort without getting caught up in it. That comes through acceptance. Acceptance is allowing unpleasantness to just be, reframing it so it is just language. Contacting the present moment means that you're physiologically present and that you're able to step back, which is the act of diffusion, and accepting that you're experiencing discomfort and that the life values you have are the most important things to you. It minimizing going inside of your head. You will hear in our video references to the checkerboard and further in this presentation, and perhaps it will become a little more clear to you how a checkerboard is a symbol of the present moment. Silence in therapy can be an incredibly powerful tool. If it's used to promote mindfulness, it allows the client to get lost in their thoughts if it's just free silence. Use silence to experience the feelings. Allow you to become comfortable with their presence in your present state. Acceptance allows those feelings, those thoughts, those memories to exist. And in the client dialogue at the bottom of this slide, you'll see that the client has a struggle going on there. They want to change, but they're anxious about it. The social worker reframes it so that it's no longer a struggle. It's not two opposites. You want to change and you are anxious about it. So they're not in opposition, struggling against each other.
The observing self Okay, the idea here is that thoughts come and go, but we are in control of how much they affect us and what we do with them. So as we become more aware of our thoughts, we gain more control over them, and we can respond how we feel is appropriate or necessary. And that leaves room for techniques such as turning off the struggle switch, which is something you'll hear about in our other video. It means accepting that bad thoughts may enter your mind, but just not worrying about when they're going to occur or what it's going to be like. Just going about your business. The more we fight against our negative thoughts, the more time we spend with them, and the worse off we end up being. We end up with secondary emotions as well sometimes, and you get anger for feeling a certain way. For values, this is really just all about figuring out what kind of person you want to be and committing to making those values be incorporated into part of your life. For example, if I had social anxiety, but the kind of person I wanted to be who was someone who was really social, then I would have to be willing to experience my social anxiety along the way as I'm, striving for my goal to socialize more. Committed action. It's the C from ACT represents commitment, and it's just committing to going through with the values that you established in the previous goal. And with less attention focused on the negative aspects, which may still be occurring throughout the new tasks, the person will be free to enjoy themselves as much as they can while being uninhibited. So where is ACT used? Individual, couple, group, family, brief, long-term. It can be used pretty much anywhere. There's, for the literature review, we have a couple studies here that show ACT being useful for people with psychotic symptoms and with drug use. Also with social anxiety, which you'll see a pretty good example of that in our other video. And for help with pain as well. So, there are some weaknesses in the study. The main one I found is that a lot of the information was self-reported, but it has been proven effective in a variety of studies and a range of severity as well, from psychosis interventions to just ordinary people just like, oh, I'm stressed out at work, stuff like that. It also covers different ethnic groups, classes, geographical regions. And something interesting about a lot of the literature is that the effect sizes seem to be larger at the follow-up rather than just right post-intervention, which I think is really good news because it means that it's still working. And this is something that takes a little bit of time to incorporate into your life and to learn how to use really well.
The example that we use in the video is the sticks and stones metaphor. And that is very representative of this too, in that you observe that someone is ready to throw a stick at you. You think to yourself, this is something that I need to respond to. Your physical self responds to it. Now, if the observing self just hears words, the thinking self acknowledges that they're just words. They're not going to hurt me. So the physical self just dismisses it and accepts that they're just words, they're just thoughts, they're just memories. In the video that we're going to be doing, it's not truly representative of an ACT therapy session because of the limited time frame that we were allowed, and also the fact that in this first session with the client, the therapist is trying to instill as much knowledge about the process as possible. And so this demonstration is a little bit more directed, a lot more directed than perhaps would be in a normal therapeutic setting.
The scenario is that I'm me, I guess, with my problem is social anxiety, and it's really been interfering with my life lately. And I have tried other interventions in the past, but they didn't work. So I go to Chris, the clinician, who is going to teach me all about ACT therapy.
I hope you enjoy it.
Thanks. For more information about the processes and just how ACT can be involved with schizophrenia or pain relief, you can check out the links that we have on the links page. And we also have a couple other links there, they're YouTube ones that just give little demonstrations of how ACT can work.